I will introduce today's first case. The patient is male in his 80s. He was admitted to our hospital with worsening chest pain. He underwent CAZ, which revealed severe in-stent stenosis in mid-RCA and moderate stenosis in mid-LAD. His coronary risk factors are hypertension, hyperlipidemia, and past smoking. He was performed PCIs for mid-RCA about 12 years ago. Today's target is in-stent stenosis in mid-RCA. 1 BMS and 1 DES were previously implanted. The syntax score is 40. I will show you today's target vision. As you can see, there is severe in-stent stenosis in mid-RCA.
So as already see the case presentation, this patient came to the hospital with recurrent chest pain, and about 7 days ago, and now we are going to conduct PCI for the severe stenosis in right coronary artery. Usually we use, these days, we use distal radial artery as an access site. And actually in this patient, distal radial artery palpated very well, but I always use echo-guided puncture because this is much more easier than finger-guided puncture. As you can see here, this is a brand new Canon echo machine, 24 megahertz with short footage. Actually, the depth of this image is 10 millimeter. So now we started performed local anesthesia, and from the beginning we use the echo guide because later it is very helpful to decide puncture point. Here you can see the lidocaine was injected in the subcutaneous space. And then you can appreciate the artery is very well imaged. So now start the puncture. You can recognize the tip of the needle, as you can see here. So we always use this procedure, even in the patient with ST elevation myocardial infarction. And also this echo-guided puncture is very helpful for the patient with cardiac collapse or cardiogenic shock. Even in such a situation, we can get the artery very precisely. And for this case, we use glide C cylinder. This is heparin. I inject heparin 6,000. 7,000 heparin was injected.あ、ごめんなさいね。ちょっと痛いかもしれません。すぐ取れますからね。すいません。Patient complaint of the pain during the heparin injection. So now we advance the guiding catheter. This is Ikari curve catheter, 6 French from Medtronic. This is guide wire. The name of this guide wire is Silver Way from Asahi Intake.右やね。入れようにお願いしますね。2ミリのバルーンも出しといてね。大丈夫ですか？大丈夫かな。As I said before, this patient is unstable angina, so actually we advance the wire and then we predilate the small balloon. Then we perform the IVAS examination. The wire I use today is a Sion wire. From Asahi Intake, and this is very soft wire. Chinkyのは大丈夫。Chinkyのはいいの。これ抜こうか。The pressure was dropped because of the deep insertion of the guiding catheter, so I retrieve the guiding catheter slightly, as you can see here. The lesion in the proximal RCA is also maybe very tight. Balloon will be inflated. Now, 12キャストでいこう。片層14。16。はい、でフレーク。結構硬いかもしれないね。この辺も遅かったね。はい、ここから24、60。14、16。はい、でフレート。はい。はい。So now the two lesion was dilated with 2.0 balloon, and then we started to examine the lumen, inner lumen with IVUS. IVUS start. So IVUS is examination started from the middle of the section number 3, segment number 3, and this is stent, and the stent expansion is good, but here, as you can see here, there is very severe stenosis was observed, and this is a stent. Actually, there is two stent was stent overlap was observed here. The previous first index stent was bare metal stent, and the second stent is cipher stent. ここも調査結構ね。スコアフレックスかね。スコアフレックス、ちょっと見せてくれ、あります。二重になってるところ見せてくれ、ステント。Here you can see it's、もうちょっと手前にして、二重になってるところ。ここらが20、これ20やね。それで1、2、3ミリぐらい。ステントとステントの間の距離は何本ぐらい ?275 ぐらい。内腔測ってよ。ステントからステントまで。2.8。2.8。ステントの出口はどう？出口はもっと出口、もっと出口、もっと出口。そこ、まあそれをもう触らんとこうか。どう？もうちょっと出口ずっと見せて。もうちょっと奥見せて。もうちょっと奥。まあ2ミリぐらい、2.5 ぐらいあるかずっと。そうやね。でもステントの中だけやね。275のスコアフレックス。So actually, after the stent, actually there is some plaque was observed, but inner lumen of that section is 2.5 by 2.5, so we dilate the tube, stent, stenosis in the stent only, and after that I moved on to the proximal RCA, and another balloon dilatation will be performed. So this is a 2.75 square flex balloon catheter. For this case, we choose RAO as a projection, and all procedure will be performed with this projection. Therefore, the X-ray dose is very important in such a situation, and we use the monitor system from Canon Medical company. So dose tracking system, and skin Actually, skin dose value was monitored. いこうか。はい、246。
スタートします。
6、8、10。硬い。はい、デフレート。硬い。はい、こうか。246。8、10、12、14、16。Actually, very hard. Lesion is very hard now. You can see here. 18。はい、デフレート。筋肉。So advancement of the balloon is very difficult now. いこうか。はい、まずめくか。246、246、80、12、14、16。これノミナルなもん。20まだまでいくよね。20までいく。20気圧 22 22 広がったか。そう広がった。So now with the pressure of 26, the lesion was dilated, as you can see here. The lesion is very hard as we expected, but now successfully dilated. いこうか。はい、248。So some part of the stent is actually dual implantation. So I think different. We'd like to avoid the triple stent here. So I would like to choose the drug editing balloon. はい、行こうか。246、80、12、14、16、18、20、22、24、26。さっきも26だったよね。はい、デフレート。So another 26 atmosphere is applied in the front in the proximal side of the stent. So I will check the fluoro and I will check. I perform the angiogram. So another balloon dilatation is the scarring balloon. I try and then dilate the distal side of the stent. As you can see here, there is a radial stenosis still observed. Actually, we get excimer laser angiography, excimer laser angioplasty equipment was standby, but maybe I'd like to finish with a conventional way.この辺ですかね。行きましょうか。はい、246。6、80、12、16、18。はい、デフレット。はい、2680。これはステントの中ね。So another dilatation was performed with same balloon. 20までいくか。This is 20 atmosphere. はい、デフレート。I'll perform IVUS examination for the lesion in the stent. Actually, advancement of the IVUS catheter is much more easier as than previous attempt. The inner room, the size of inner lumen of the vessel here is around 2.5 by 2.5. Here is stent, and the stent is well dilated, and the plaque is also compressed. And there is some stenosis, residual stenosis here, but maybe this is very difficult to dilate because of the previous stent. So, まあそんなに悪くないね。手前に一応見ておきましょうか。これはもう3ミリぐらい。So proximal side of the RCA is about 3.5. Inner lumen was about 3 by 3 millimeter by 3 millimeter. So we are going to apply the drug-eluting balloon to the distal part of the lesion. Actually, in stent restenosis, it is very important to advance the balloon without touching the balloon portion. This is a 3 mm by 30 mm drug-eluting balloon. 長すぎますか。長すぎた。Advance of the drug-eluting balloon is also very difficult. Yes. ちょっとこの辺でね。はい、行こうか。はい、246。10気圧。We apply the drug at the in the stent portion and also distal part of the vessel after the stent. because there is some stenosis, and also we apply the cutting, we apply the scarring balloon after the stent, so we apply the drug, both section. はい、何抜きますか？デフレート。So we dilate this balloon for 60 minutes, 60 seconds, and retrieve the wire, retrieve the balloon, as you can see here. Then we apply the stent to the proximal part of the RCA. So I choose giant stent with size 3.5 by 33 millimeter. Cover all the region from the proximal side of the previous stent to the previous stenotic region. Actually, it is very difficult to deliver this stent. So we'll use extension guiding catheter here, monorail type extension guiding catheter. It's a Japanese made. Actually, the name of this extension guiding catheter is Guide Plus from Nipro company. Nipro company actually. As you can see here, this extension guiding catheter is very easy to advance such a difficult region. Very slippery actually, and advance very well. And then I will advance the giant stent. Yeah, you can see here. So I retrieve the extension guiding catheter, as you can see here. Dilate this stent. はい、まだステントあるよね、こうね。はい、ずーっと。はい、行ってください、そうして。はい。はい、持って。はい、どうぞ。ここで、はい、行こうか、はい、2、6。
スタートします。
はい。6、8、10、12、14、12。14。14 atmospheres here I applied for this stent. So second inflation, as you can see here, 14 atmosphere I applied for this stent. 大丈夫だと。はい。ドーストラッキングシステムどうなってます？今大丈夫。So I will check the whole region with IVAS from now. IVAS 動く。So this is a stent region, and inner lumen was well dilated. And some part of the region is not dilated, not very well, but I think this is the limitation of the stent restenosis, in particular, or such a stent implanted long time ago, about 10 years ago. So this is ちょっと入稿見ようか。So actually, the stent seems to be okay, but I will check the ostium of the RCA. 今引いてる？引いてよ。This is very proximal. I think it's okay. About 1 or 2 millimeter was missed, but I think it's okay because ostial of this RCA is healthy. Therefore, I think this is okay. So I will check the result with angiogram. So I hope this will be a final angiogram. はい、行きましょうか。はい。大丈夫ね。はい、クラニアル。終わりましょうか。So I would like to finish this case. So then we will show you how to make hemostasis after the distal radial puncture. Actually, there is so many, not so many, but there is many methods has been introduced, but actually from the beginning of the introduction of the distal radial artery approach, we constantly use this hemostatic method, which I will show you now. Actually, there is a dedicated device, but we do not use such a device. And this is a hemostatic part, which called Stepty from Japanese Nichiban company. This is a pad and tape here, and then so this is a bandage. This is a very elastic fabric, made of very elastic fabric, and we apply this now, as you can see here, and several times I will make a compression, and then we retrieve the sheath, and then finished. Thank you very much. This is our strategy for the PCI with using distal radial approach. So I'd like to make a final review for this case, and this case is a little bit tough case. Although the lesion is located in stent and native proximal region, but actually there is so many microcalcification is there. So for the in-stent stenosis, the balloon dilatation was very tough, and I used scoring balloon, and final pressure was 26 atmosphere, and then the lesion was dilated. So actually some part of the stent is two stent implantation was previously performed. So therefore, I would like to avoid another stent inside such a two stent placed lesion. So I completed with this lesion using drug-coated balloon. And after that, I move on to the proximal portion. And there is a continuous plaque accumulation from the proximal side of the stent to the ostial of RCA. So therefore, after the pre-dilatation with same scoring balloon, I place a long giant stent. But delivery of such a long lesion is very difficult because of so many friction modes existed. So I produced newly developed extension guiding catheter, which called Guide Plus from Nipro company. And as I showed in my procedure, the advancement of this extension guiding catheter is very easy. Actually, this guiding catheter advanced to the distal region. So then I advanced the stent, and then I placed the 3.5 by 30 millimeter giant stent. And actually, as I said in the procedure, during the procedure, this procedure was performed only one projection, actually LAO. So therefore, I was very worried about the skin dose. And here, as you can see here, this Canon angio system equipped by the dose tracking system. This enables to know simultaneously the peak skin dose here. And this is final value at 1078 milligray. Actually, this is a very reasonable maximum skin dose, and very useful for such a complicated lesion. And actually, I am very happy with the result, and patients now very good. And maybe I recommend this system for your practice, especially with CTO or such a complicated lesion. Thank you very much.
Canon Medical. Made for life.